Dear students, Vanakkam. We notice some of the students finding it difficult to understand what is a fixed abduction or adduction deformity in the hip, and they tend to forget things and finding it difficult to express themselves in the examination. So we thought of devising a new tool so that the fixed abduction deformities in the hip can be explained easily and the students can understand in a better manner so that they can remember forever. Let's go to the tool. I dedicate this Fad-Ec tool to my co-postgraduate friend and above all my beloved teacher, Professor V. Singar Vadivelu, on the eve of his retirement from government service.
This is the tool. Consider this two as the hip joint, and the normal amount of abduction possible in the hip is 0 to 45 degrees, and the normal amount of adduction possible is 0 to 30 degrees. Suppose the patient is having an abduction deformity of 20 degrees in the right hip. So I am keeping a block here. The patient is, the right lower limb is in the 50 degrees of abduction at the level of hip, and further adduction is not possible even up to neutral. But however, further abduction up to 45 degrees is possible. So this is called as fixed abduction deformity. When you ask the patient to lie down supine on a couch, he cannot lie down like this, and he will try to keep the limb parallel to the axis of the body like this, so that he will mask the abduction deformity by tilting the pelvis. So naturally, now you can understand that ASIS level will be at a lower level than compared to the unaffected limb, and there is an apparent lengthening on the affected side. So the apparent length discrepancy can be measured from a point above the level of umbilicus. Usually we take the sternum. So this side it is 37 centimeter and this side it is 33 centimeters. So this is the difference in the apparent measurement. There is apparent lengthening. Now when you examine, you have to measure how much is the abduction deformity. So for that you have to keep your fingers over the ASIS and try to bring the line connecting the ASIS perpendicular to the axis of the body by holding both the lower limbs and start moving. Okay. So the moment the line connecting the ASIS is perpendicular to the axis of the body, you stop. Then you try to adduct the affected limb. The stop the moment it starts tilting. So this is the amount of abduction deformity. This is called squaring of the pelvis. That is bringing the line connecting the ASIS is perpendicular to the axis of the body is called as squaring of the pelvis. Now for measuring the true measurement, after squaring the pelvis, both the limbs have to be kept in identical position. So the left limb also should be kept in 20 degrees of abduction. Now you can measure from the ASIS to the tip of the medial malleolus. That is the four-link measurement, and segmental measurement like Bayes triangle and infratrochanteric measurement also to be done only after squaring the pelvis and critical position. So now if you measure it from the ASIS, it is 22 centimeter on this side, and here is also 22 centimeters. There is no difference in the length, in spite of there is a apparent lengthening. Now let's assume that there is a fixed adduction deformity on the right hip. So there is a 20 degrees of adduction in the right hip.
When you try to abduct, even up to neutral is not possible.
But further adduction up to 30 degrees is possible. So this is called as fixed adduction deformity. So when you ask the patient to lie down supine, naturally the patient will try to keep the affected limb parallel to the axis of the body by tilting the pelvis like this. So now you can easily understand that the ASIS is at higher level than the opposite side, and there is a apparent shortening of the affected limb that can be measured from the Ziffy sternum on both sides, and there is a apparent shortening on the right side. Now when you examine you have to calculate the amount of fixed adduction deformity. For that, you need to square the pelvis. So, by holding both the lower limbs and keeping fingers over both ASIS, try to bring the ASIS to the same levels. That is, the line connecting the ASISI should be perpendicular to the axis of the body. Now, this is the amount of fixed adduction deformity.
Try to abduct the hip.
The moment the pelvis start tilting, you have to stop it. So, this is the amount of fixed adduction deformity, and you can measure how much further adduction is possible. Okay. Now, you have to measure the true length. For that, after squaring the pelvis, you have to keep both the limbs in identical position. So, this limb also has to be brought to 20 degrees of adduction as that of the affected limb. Now, you can measure from the ASIS to the tip of the medial malleolus on the affected side, and when you come to measuring the unaffected side, you again bring it above the affected limb and keep it in same amount of adduction, and then you measure. Now, you can appreciate that there is no true length discrepancy in this case. I hope it is now clear when there is a unilateral fixed abduction and adduction deformity. When there is a problem in both the hips, there is a bilateral hip case like ankylosing spondylitis, rheumatoid arthritis, or bilateral avascular necrosis hip. There can be deformity in both the lower limbs. So, one limb can be in a fixed adduction deformity and one limb can be in a fixed abduction deformity. So, in those cases, squaring of the pelvis may not be possible. So, when you try to square, either the limb will move or the pelvis will tilt further. Okay. So, squaring of the pelvis itself will be difficult. But sometimes you can try to move the limb to some extent and squaring of the pelvis can be achieved. But since there is one side abduction deformity and one side adduction deformity, keeping both limbs in identical position is never possible. So that there is no question of true measurement in bilateral hip whenever there is a fixed abduction deformity and adduction deformity exists in either hip. Hope you are clear with the fixed adduction and abduction deformity. All the very best.